Hello, I'm Dr. Imran Ismail, board certified cardiology, here to talk to you today about the heart and COVID. The effects of COVID have been felt by nearly everybody on this planet. It has touched many, many lives, and we've learned a great deal about this disease over the time we've had to deal with it. We have learned that there's been many effects of COVID on the heart and the cardiovascular system. Most importantly, who's at greatest risk of having complications from COVID? These include people that have been diagnosed with heart failure, coronary artery disease, and heart muscle disease such as the cardiomyopathy. Patients that have obesity, high blood pressure, and diabetes are risk factors for having more severe COVID infections and poorer outcomes. Now, why does this happen? Because many times COVID can affect the heart muscle in a way that makes these diseases worse. So if you have heart failure in the past, having a COVID infection can make heart failure worse the second time around. It can make your coronary artery disease worse, causing heart attacks. It can also make your cardiomyopathy worse as well too. So we know that COVID affects the heart, but why does it also affect so many other organs? Well, it's because of something called an ACE receptor, which determines how COVID virus particles enter into our body. These ACE receptors all throughout our body, including our lung tissue, our heart tissue, our gastrointestinal tract, also our nerves, and most importantly, our endothelium, which is the lining of the blood vessels in our body. Depending on where these ACE receptors are and what concentration the virus gets into our system will determine how bad your symptoms are. For example, with lung ACE receptors, patients will develop pneumonia or respiratory failure. Patients with ACE receptors in the heart that COVID infects will have issues like myocarditis and heart failure and even heart attacks. GI tract issues can result in diarrhea and other nausea, upset stomach, and patients can have nervous issues as well, including neurologic changes with COVID long term. So what can COVID do to my heart? We have noticed over the time that COVID infections can lead to things like heart muscle inflammation, which is also known as myocarditis, where the inflammation in the heart muscle feels like a heart attack, severe chest pain that forces patients to come to the hospital. It also puts you at higher risk of heart failure once you have the myocarditis. We've also noted a high risk of patients having irregular heartbeats, things like arrhythmias as sinus tachycardia and atrial fibrillation. There are two reasons why patients have this. Number one is the direct inflammation of the heart muscle itself, where you have irregular heartbeats because of the irritation. The second thing is the play between the lungs and the heart. When the lungs are inflamed and infected, your oxygen level gets low and the heart has to pump that much harder to get the blood to where it needs to go to. That many times leads to irregular heartbeats. COVID can also affect the inflammation of the lining of the blood vessels. These vessels go throughout our body, our heart, our brain, our arms, our legs, and wherever the infection settles in can cause things like blood clots, which can lead to heart attacks and even strokes. We've also noticed that COVID can cause right-sided heart failure, where the strain on the right side of your heart can lead to things like lower leg swelling, abdominal swelling, liver failure, and even kidney failure. Most importantly, the most preventable thing that COVID does to your heart is keeping you from getting the care that you need. Keep in mind that the hospital is still the safest place if you're having a heart attack, even during a pandemic. When COVID first hit, there was a 6-fold increase in deaths at home because patients were scared to come to the hospital. So what about long-term COVID heart? Well, most cases of myocarditis heal spontaneously if the patient survives the initial infection. However, 2/3 of patients that recover from COVID have evidence of heart damage seen on MRI. And remember, some of these patients have permanent cell death and scarring of the heart muscle. So what is the best way to prevent long-term COVID heart? To not get COVID in the first place. The best way to do that is to get your family and yourself vaccinated. The vaccine has been shown to be safe and effective in preventing COVID and the severity of the disease. However, there are some rare cases of heart inflammation that have been showing up with COVID vaccines. 1 in only 6,000 cases were reported in teenagers, and fortunately, they were all very mild cases and self-resolving. Remember, the chance of developing a severe illness and death from COVID-19 is much higher. The research shows that up to 2 to 10% of patients with COVID-19 can develop these. And also, there's a higher risk of developing myocarditis from COVID itself than there is from the vaccine. And at this time, most hospitalizations, particularly critical care, intensive care units, and deaths are related to unvaccinated groups. So how can I maintain my heart health during this time? One of the biggest challenges we've been facing as physicians is that because of COVID, people were staying indoors and their active lifestyles had been scaled back. We want you to get active again. We want you to eat well, stay active, exercise at least 20 minutes every single day, and get yourself and your loved ones vaccinated. I'm Dr. Imran Ismail, and thank you for your time.